The toe hold is a footlock submission. It has been around for a while, despite a taboo on footlocks in the world of jiu-jitsu that existed until fairly recently. I've already talked about the heel hook. You can see that video if you want. The toe hold is another variation of the footlock that can damage things differently. This submission can apply a lot of torque through the lower leg and can cause some fairly significant damage. In this video, we'll explore the anatomy of the ankle and lower leg and specific injuries that can occur around the ankle. I will also discuss why the toe hold is such a powerful submission and what treatments may be necessary based on the injury that occurred. So, let's talk about the anatomy. The ankle joint is an interesting joint. It is the meeting up of the bones of the lower leg and the bones of the foot. Specifically, the big shin bone, called the tibia, and the smaller bone, called the fibula, articulate, create a joint, with the uniquely shaped talus. The ankle joint works like a hinge by going up and down, dorsiflexion and plantar flexion. That means turning of the ankle is actually happening at other joints of the foot or the knee. If something or someone tries to take the hinge off its usual up-down motion, damage can occur. The tibia supports about 85% of the weight that goes through the lower leg, while the fibula gets the other 15%. The tibia and fibula are connected by strong tibio-fibular ligaments. We also call this area the syndesmosis. This is what is injured in a high ankle sprain, but I'm getting ahead of myself. In fact, there are structures that connect the tibia and fibula along their length up towards the knee. There is some motion between the tibia and fibula, but it is tightly controlled by these ligaments. The connection of the tibia and fibula is very important, as it makes a bracket that encases the talus and keeps the ankle joint stable. We call this bracket the mortise. What makes the talus bone interesting is its wedge shape. It is broad in front and narrow in the back. This changes the stability of the ankle joint based on its position. With dorsiflexion, or bringing the foot up, the wide front of the talus is within the mortise, and there is more bone engagement, making the joint more stable. With the ankle in plantar flexion, foot down, the smaller part of the talus is now within the mortise, making it less engaged with bone and less stable. The ligaments surrounding the joint then must do more of the stability job. Feel free to experiment on yourself. Feel how different your ankle moves, feels, depending on what position it's in. So, the ligaments. The ligaments that support the ankle joint are on the sides. The big deltoid ligament is on the inside, medial, and attaches the tibia to the talus and other bones of the foot. It is a broad structure that is actually made of 4 different smaller ligaments, but the point is that it is a strong, stable ligament. It resists eversion of the foot and ankle. The outside, or lateral ankle, is supported by 3 smaller ligaments that connect the fibula to the talus, 2 of them, or the fibula to the calcaneus. These ligaments protect against inversion of the ankle. So the injuries. Generally speaking, injuries to the ankle are very common. As we get into these injuries, it is important to understand that the structure of the ankle can be thought of as a ring, and it is really hard to break a ring in just one place. This means that often there are multiple injuries around the ankle when an ankle injury occurs. The upper part of the ring is formed by the mortise, or joint of the tibia and fibula. The lower part of the ring is formed by the subtalar joint. This is the joint between the talus bone and the big heel bone, the calcaneus. The sides of the ring are formed by the medial and lateral ligaments. The simple ankle sprain usually is involving overly inverting the foot and ankle, and the lateral ligaments are injured, most often the anterior talofibular ligament. This, fortunately, can be just an isolated injury. The high ankle sprain is an injury to the ligaments between the tibia and fibula. This is also called the syndesmotic injury. Instead of inversion of the ankle, it's usually external rotation that causes the injury, and usually in combination with dorsiflexion of the ankle. With the talus engaged within the mortise, the twisting force will force the space between the tibia and fibula to widen and can injure these ligaments. If taken to the extremes, this force can continue up the whole connection between the tibia and fibula and then exit out the top of the smaller fibula, resulting in a fracture. We call this a Maisonneuve fracture. This is a sign that the ankle joint is unstable, as the mortise will not adequately hold the talus anymore. This is why orthopedic surgeons may obtain knee x-rays with certain ankle injuries. Ankle fractures. Us orthopedic surgeons have described ankle fractures based on what position the foot and ankle were in and the direction they went when the injury happened, such as supination or pronation combined with eversion or adduction. The point is, the foot and ankle can go in all sorts of directions, but if it goes too far, bad things start happening. Different fracture patterns arise based on the direction the forces went. Along with a broken bone or bones, there are also often torn ligaments. If the mortise is disrupted by the fractures and or ligament tears, then surgery will be necessary to restore the talus within the joint. So, the toe hold, theoretically why you're here. This submission is most often applied by having a figure of four or kimura type of grip on the foot. Usually the submission involves bringing the foot down and in, knowing what we do with the ankle anatomy. If there is plantar flexion of the ankle, the stresses are initially going to be on the ligaments, which will tear or avulse from the bone if too much force is applied. This includes the lateral ligaments of the ankle, but it can also injure ligaments or tendons down the foot. I've even seen a few broken bones in the foot by not tapping to a toe hold. One of these is called the fifth metatarsal avulsion fracture. Physics dictate that the larger the moment arm, the more force that can be applied. A lever works better the further away from the fulcrum you are applying the force. This is why the move is taught to grab higher towards the toes, not too far so you don't slip off. Also, to get this submission to work, you must also have the opponent's hips secured so they can't twist away. If there's more ankle dorsiflexion, more stress is going to be put into the bones around the ankle. Certainly the ligaments at the ankle are stressed, but the forces may result in a fracture of the fibula or tibia. If the twisting forces are just right, that force may get carried up higher into the tibia and fibula. Bones are strong, but they hate being twisted. This twisting can cause them to break higher up. There are variations of toe holds that take the ankle into eversion, and this would create injuries like a high ankle sprain if enough force was applied, but this is hard to do. So the treatment. Alright, so you didn't tap, and you felt a pop. The vast majority of the time, this is going to be a ligament sprain or tendon strain. It will hurt to walk, but it will eventually feel better. Foot and ankle injuries do take a while to get better. Even a simple ankle sprain can take 6 months to feel right. Of note, if there are repeated lateral ankle sprains, this can become a chronic issue, causing ankle instability. So, it's a good idea to let those ligaments heal. A foot fracture may require more than just watching it, but often a hard-soled shoe and patience will do the job. The big injury is if the tibia and or fibula break. This often requires surgery if the mortise is compromised. Tibia fractures not at the ankle joint can often be treated with a large rod down the center of the bone. Fractures of the tibia and or fibula at the ankle joint often require plates and or screws. Again, foot and ankle injuries take a while to heal. This is partly because we put a lot of stress on them just walking. They will stay swollen, inflamed longer because they are below our hearts when we're upright. Broken bones often take 6 to 8 weeks to heal even in ideal conditions, but then it will take additional time to regain strength and range of motion and get the swelling and pain down. Also, sprains take a long time to heal because ligaments have poor blood supply and just heal slower than other tissues. All right. A fairly good intro to the ankle joint, as well as to the toe hold submission. I'm Dr. Lucius Pomerantz, black belt in Brazilian Jiu-Jitsu, and an orthopedic surgeon, trying to combine these two worlds. As always, please do not forget to like, share, subscribe, and get notifications so you can be alerted by my new videos.